Hello, everybody. Welcome to the first IACAPAP Lunch and Learn webinar. I'm the today's host about the our webinar. Let me introduce myself. I'm Dr. Kim Bung-Myung from Seoul. I'm working at the Seoul National University Hospital as a director of a division of child adolescent psychiatry. And also I'm a president of a Korean Academy. I'm very honored to be a host today. And also I will give really big thank you for the attending first IACAPA webinar today. Many of today's attendees may have very interested in the today's webinar topic, the child mental health in conflict zone. It's very timely topic. I think this is very disastrous season nowadays. So you can learn many things about the PTSD or acute traumatic stress reaction or some more things and intervention technology from today's webinar. Also, I would like to thank the Professor Udena, who is the president of Sri Lanka College of Child Adolescent Psychiatry for today. He is also today's webinar chairperson. And also, lastly, I would like to thank Dr. Miyuru, who will give today's lecture about child mental health in conflict zone. Okay, so we will start right now. Please, Dr. Udena.
Thank you, Dr. Kim. On this occasion, I would also like to thank IACAPAP for giving the Sri Lanka College of Child and Adolescent Psychiatry an opportunity to kind of talk to the wider IACAPAP community. So today's talk will be on mental health, child mental health in conflict zones. And our speaker will be Dr. Miyuru Chandradasa. I will introduce him. Dr. Miyuru Chandradasa, MBBS, MRC Psych MD, is a consultant child and adolescent psychiatrist attached to the Colombo North Teaching Hospital in Ragama, Sri Lanka. He's also a senior lecturer at the University of Kelaniya, and he previously worked as a senior honorary lecturer at the Monash University in Australia. Dr. Chandradasa has obtained his postgraduate qualifications in psychiatry from Sri Lanka, Australia, and the United Kingdom, and he's the first board-certified child and adolescent psychiatrist affiliated with the University of Kelaniya. Dr. Chandradasa has won National Research Council, Senate, and Vice Chancellor awards for his research related to child mental health in Sri Lanka, and he has presented the prestigious Dr. S.C. Paul oration at the 133rd anniversary sessions of the Sri Lanka Medical Association, which incidentally is the oldest professional medical association in Asia and Australasia. During the last 5 years, Dr. Chandradasa has published more than 60 articles in international and local indexed peer-reviewed journals. He is currently conducting research in character and personality development in adolescents in Sri Lanka. And Dr. Chandradasa is the current secretary of the Sri Lanka College of Child and Adolescent Psychiatrists, and we are proud to be a full member organization of the IACAPAP. So I would like to invite Dr. Miyuru Chandradasa to continue with his presentation and talk to us.
Thank you, Professor Kim and Dr. Udena, and also Sue for arranging everything. Good morning to you all in East Asia, Australia, and New Zealand. Good afternoon to you, everyone, in middle of Asia, Middle East, Africa, and Europe. Thank you for joining for the webinar. Today, I'm going to speak about child mental health in conflict zones. To begin the presentation, I would like to say that I have no financial disclosure or conflict of interest with the presented material in this presentation. My goals today would be to talk about armed conflicts in the world, specifically about Afghanistan and the ongoing humanitarian crisis, and also to talk about the local perspectives from Sri Lanka about the end of war and mental health. Also, I would like to share my personal experience as a child psychiatrist working with children affected by the Easter Sunday attacks and the lessons I learned. And also how an international organization like IACAPAP can help in this kind of conflict settings. My talk will be based on these 5 papers I have published with my co-authors in the recent years, which focuses on the post-war mental health in Sri Lanka, the conflicts in Kashmir and Afghanistan, as well as our own experience related to the Easter Sunday attacks in Sri Lanka in 2019. To begin the process today, I would like to first talk about conflicts in the world. I would like to ask Sue, our administrator, to share the poll asking all the audience, have you practiced in a country affected by an armed conflict? So please answer the poll questions and we will see the results in the coming slides. To define what is state-based armed conflict, I would like to go to the definition provided by the Uppsala Conflict Data Program. State-based armed conflict is a contested incompatibility that concerns government or territory, which uses armed force between military forces of 2 parties, of which at least one represents the government of a state. And the Uppsala conflict data program defines that it should have resulted in at least 25 battle-related deaths each year. If you consider the conflicts in the world, you can see the Uppsala conflict data program's map of conflicts over the past few decades. Unfortunately, almost all countries of the world have been affected and significant mortality and morbidity has occurred. And also you can see a red circle on top of Sri Lanka in this map. So I would like to ask Sue to share the results of the poll to see what percentage of audience have worked in a country affected by an armed conflict. Okay, interesting. 43% has worked in a country affected by an armed conflict. Thank you. If you consider conflicts by world regions, this map by the same reference shows how conflicts have increased over the last decade. In the yellow color, you can see the conflicts have worsened and increased in the continent of Africa. In light green color, you can see the conflicts shown in Asia. And in the bottom, in dark blue color, you can see Europe. And with the Ukrainian conflict, I'm sure there will be increase in conflicts in that region as well. So this is the map showing current conflicts in the world. So many countries in Africa and Asia are involved in ongoing armed conflicts. So you can see already the maps of Ukraine and Russia has been colored red, indicating that there is conflicts going on, which has been going on since 2014 with the Russian incursion into the eastern Ukraine. Today, if we switch on international news, it is full of news about Ukraine-Russian conflict. Unfortunately, almost 2 million Ukrainians have been displaced to countries onto the west of Europe, as well as some are internally displaced. Also, because of this condition, it has caused significant trauma to children in Ukraine. So I would like to show you a clip of a Ukrainian father. Now, the Ukrainian government has asked men, fathers, uncles to stay back and fight, while mothers, women, and children can escape the war and go to a country like Poland, Romania, or Moldova. So this video clip, hope you will be able to hear the sound as well, is where a Ukrainian father is saying goodbye to his daughter when the daughter has to go, but he has to say. Sometimes when mothers cry, those videos don't go viral, but this video shows obviously how traumatized the father, mother, and the daughter is. So this is the actual real felt trauma of war. Before I move on to specific information about Afghanistan, I would like to ask Sue, our administrator, to share the second poll. Is the mental health of children in your geographical region affected by conflicts in the world? So that means you may not be working in a conflict-affected country, but is the children and adolescents you see are affected by what's happening on international news and other news media? Thank you for answering the poll. We will share the answers in a short while. Moving on to specific information of Afghanistan, because before the Ukrainian conflict, this was the main headline of all international media. As you very well know, the situation in Afghanistan is an exacerbation of a long-standing concerns and conflict. In a study done in 2021 of Afghan immigrants displaced to Iran, the authors found that nearly 35% of the immigrants were suffering from significant psychological disorders. That was twice the amount experienced by the native population in that region. Children of Afghanistan have faced decades of unrelenting trauma. To understand the transgenerational effect of trauma, I would like to highlight two remarkable studies. First, by Kobos et al. In 2018, and the second by Dungu et al. In 2021. They studied more than 700 married women, and 71% stated that they have used violence against their children during the past month. What were the associated factors? The mother stated that their own experience during their childhood of witnessing their mothers being physically abused, probably by their fathers or maybe by other men, and their husbands using corporal punishment increased the likelihood that they would also become perpetrators of violence towards their own children. In a separate study, they have studied school children, where more than 30% of 350 boys and more than 80% of 420 girls stated that they have perpetrated more than once cruelty to another peer or a schoolmate during the past month. So you can see the transgenerational effect of 3 generations of trauma because of the unhealed, unprocessed trauma they experience. So the cycle of trauma rolls on without active psychological interventions. So this is a picture. Some of you may be familiar with this picture. This is Murtaza Ahmed, a little boy. When he was 5 years old, he was pictured by his father wearing a makeshift t-shirt made by a bag with the name of Lionel Messi. I hope you know Lionel Messi. He has won the Ballon d'Or 7 times, considered to be the greatest football player of all time. And fortunately, he was able to meet his idol later when he was 7 years. But unfortunately, due to the Taliban excursion last year, it is said that currently he lives in Kabul and currently he is in danger because of this news item that was published about him. Not only that child, but thousands of children in Afghanistan have suffered significant effects due to the psychosocial crisis, due to the most recent military escalations. Children in Afghanistan are experiencing acute food insecurity, malnutrition, displacement, all have a significant effect on the mental health of children. And also loss of family members and poverty and uncertainty about the future of their life. And from the 30 million population of Afghanistan, almost 57% are children, because it's a very young population, and this burden is enormous considering the age of the population. So even recent assessments have shown that more than a third of the children have experienced significant psychological stress in the background of constant risk to themselves and their families. I would like to ask Sue to share the results of the second poll. Thank you. So 84% of the participants today have mentioned that children in their regions are affected by what's happening around the world in related to conflicts. Now I like to share some local perspectives about Sri Lanka, the end of war and mental health. The northeastern parts of our country were ravaged by a civil conflict for more than 3 decades. It ended in 2009, but before that, the whole country experienced frequent bomb blasts and more than 60,000 people lost their lives. I'm sure the numbers are far higher than that. If you ask any Sri Lankan around the world, what does the year 1996 mean to them? Every Sri Lankan would say it is the Cricket World Cup where Sri Lanka beat the mighty Australians to become the world champions. But 1996, in my childhood, was a very difficult period. As Sri Lankans joining here today will remember, it is the year where there was a massive bomb blast in the center of Colombo, where the central bank of Sri Lanka was attacked. Almost 100 people lost lives on that day. I can personally remember, I used to be in the school hostel, few kilometers from this blast site, where I heard the blast sound. And my mother was supposed to visit me on that day, on January 31st, 1996. And she used to come from my village in a train and get down from the railway station, and she used to take the bus in front of this bank, which had the bomb blast. Those days, there was no internet, no mobile phone, and for hours, I didn't know what has happened to my mother. Fortunately, she was safe, she was not injured. But even during these few hours, I can still remember the horror I felt. So how about the children in Sri Lanka who actually lost someone during the war? Not only children of the south of Sri Lanka, but children in the north suffered far significant trauma. This picture is of the Jaffna Public Library. If you are familiar with Sri Lanka, Jaffna is the northmost city in Sri Lanka, which is the capital of the north part of country. This public library was burned on June 1st, 1981, after an arson attack. So many describe it as a form of biblioclasm. If you are not familiar with the word biblioclasm, biblioclasm means ethnic cleansing through violence. So many books that were 100 years old were destroyed within a day. So studies in the north and east by Somasundaram et al. And Albert et al. Found that whole range of psychiatric conditions were found among children exposed to the war: depression, anxiety, and post-traumatic stress symptoms. 90% of the children stated that this is immediately after the end of the war in 2009, that they experienced severely traumatizing events like combat, shelling, bombing, witnessing death of a loved one. And 25% had ongoing post-traumatic stress symptoms. And all these unhealed trauma is likely to affect their adulthood for decades to come. Now, I would like to share my personal experience in relation to the Easter Sunday attack and the lessons I learned. After 2009 end of war in Sri Lanka, there was a decade of peace and stability. where our tourism industry grew, and we were rated as the best country to visit in the world by the Lonely Planet website. And we climbed on to the high human development category, and we moved to the upper middle income status as a country. But this recovering stability was hit with a major blow on 21st April 2019, where religious extremes affiliated to the Islamic State bomb blasted several churches and luxury hotels. I work in a hospital called Colombo North Teaching Hospital, only 25 kilometers away from the biggest catastrophe in this bomb blast, which is the St. Sebastian's Church in Negombo. Because we have very limited number of child psychiatrists and psychiatrists, our services are mainly hospital-based and not community-based. At the moment, we have only 8 child and adolescent psychiatrists actively practicing in Sri Lanka, and in 2019, it was less than that. And at the time of the Easter Sunday attack, I was the only child psychiatrist for that district of 2.3 million people, and the traumatized children were sent to our clinic. So this is a picture where the church is going through religious rituals after the bomb blast. Children affected by the Easter Sunday attack fell into 3 groups: who were at the site of the bomb blast, either the church or the luxury hotels, who were directly exposed to the violence. Second group, who were not there at the blast site, but were at the exposed to the trauma through media, because for a couple of months, every Sri Lankan media was telecasting about this incident. And there was a lot of rumors spreading through the social media of further attacks. And obviously, children of Islamic faith, due to the socio-cultural context and the backlash from the community, because this involves certain religious extremists. So schools were closed for a few weeks, and before the start of the schools, military personnel had to go to every class, every inch of the school ground to check whether there are bombs hiding there, aggravating further attacks. And every school kid entering the school premises were checked whether they are carrying any explosives. So this was very traumatized to us as parents who experienced similar things as children 20 years ago due to the war in the northern part of the country. But also having to see our own kids go through this was very traumatizing to me as well as many other parents. I will give some examples of children who was seen by me during this period after the Easter Sunday blast. First is Miss S, 16-year-old teenage girl. She was a school prefect and a band leader. She's Sinhalese and Catholic, and one of her relatives, her maternal aunt, got injured during the blast at the St. Sebastian Church in Negombo. She was very extroverted, having a lot of friends, taking responsibilities, a leader, but she refused to leave the room for several weeks and was screaming day and night due to anxiety, and she was brought to our clinic. Second, Master K, 5 years. He was happy and doing his work at the nursery, a very playful child. He's Tamil and Catholic, and he obtained minor injuries. So because at the time of the blast, his mother got a phone call from his father. So she grabbed his arm and went outside the church. And at that right moment, the blast went off, and the child was only injured with minor injuries to the leg. But after this blast, he was not able to sleep for days on, and he was not speaking to anyone for a few weeks until he was given psychological interventions. Third, Miss G, a 13-year-old early adolescent. She was first in the class, very punctual, perfectionist, and methodical. She was Sinhalese and Buddhist. She was living in the close vicinity of the blast in Negombo. And after this incident, she was anxious, refusing to go to school, having flashbacks and nightmares. The fourth is Master T. He was 10 years old back then in 2019. He loved school and football. He was from a Muslim family. And even though he was not directly exposed to the trauma, he saw several news items on media and rumors on social media about further attacks. After the blast, he became irritable, disruptive, and he complained of several difficult pains in the body like headache, abdominal pain, which were investigated by the pediatrician but found to have no organic basis. So hundreds of kids were turning up at the clinic and only one child psychiatrist. It was a major challenge to manage all these kids. So to overcome this burden, I had to work with multiple divisions in health and education. Obviously, many general adult psychiatrists took the leading role with the help of the pediatricians, schools, teachers, school counselors, and the community leaders and religious leaders, clergy, as well as the support of the media. What did I do with the rest of my team to overcome emotional trauma? So first of all, children were allowed to be referred to the child psychiatric clinic for any person. A clergy, teacher, parent could directly bring a child to the clinic without having to go through other medical practitioners or the pediatrician to minimize the waiting time. And depending on the emotional and psychological trauma they have, they were offered support psychotherapy, cognitive behavior interventions using a booklet that we made using the local languages. And we trained health staff and teachers to implement behavioral interventions. So there was sort of support from the regional health services to train school counselors, teachers, as well as nursing officers. And in some cases, psychopharmacotherapy was used. Also, to make the general public aware of the consequences, we shared leaflets on psychological consequences of mass trauma and possibility of radicalization on social media and electronic media. And we participated and developed videos about the psychological trauma and what parents and teachers do to support a child in emotional distress. So these are a few pictures of the booklet we prepared to manage emotional trauma in children. So this is written in Sinhalese. And this was distributed among the nursing officers and school counselors and teachers who obtained our training, so they can themselves, without the presence of an expert, can implement simple relaxation techniques and coping strategies to help these traumatized children. So what are the lessons I learned after this experience? What are the challenges? First, the limited number of child and adolescent psychiatrists. So I successfully liaised with general adult psychiatrists, and there was enormous support from them to manage along with the pediatricians. And lack of child and adolescent counselors for trauma therapy. We couldn't wait for extensive proper training. So what we did was we arranged workshops, half-day, two-day workshops in training school counselors with the help of the Department of Education and regional directors of health. And also, we had limited access to psychotherapy because of the higher numbers of children and less number of psychotherapists. So we developed the previously shown simplified cognitive behavior intervention booklet based on trauma-focused CBT, and we train nursing officers how to use it. And there was lack of awareness about the psychological response of children to trauma, and many parents did not recognize this is related to these blasts. So we provided psychoeducation material which were very cost effective using electronic media, diagrams of newspapers and leaflets, which were shared more than 2,000 times over 24 hours. And limited access to child mental health services. So to minimize the waiting time and the barriers of access, we allowed anyone to refer children directly to our clinic. In the final section of my talk, I would like to talk how a reputed international organization like the IACAPAP can help in this kind of complex situations. We need to provide and facilitate collaborations between professionals in the affected country and international professional associations like IACAPAP and other experts from experience of similar settings can support the countries that are having ongoing conflicts. And we can provide technical support and maybe softwares to create referral systems so the first contact health professional or the person can directly communicate with the specialist using a feasible technique, and telepsychiatry facilities can be provided from even an overseas center. And we need to help these countries with ongoing conflicts to provide expertise to culturally adapt psychometric tools and psychological interventions which can be implemented by non-experts. And we need to support these countries developing psychoeducation material such as leaflets and maybe radio messages which can be even used during conflict. So you may see that the TV tower, television tower, broadcasting tower in Kyiv in Ukraine was destroyed by missile attacks, but still a radio message or a message on the social media can still be shared among the affected population. And also what we can do from another country, maybe from a neighboring countries, to provide psychological first aid through a toll-free hotline. It doesn't have to be from the same country. So children and parents can talk and get psychological support over the phone. And obviously, what we need to support is building training manuals for medical professionals and other professionals to deliver simple, cost-effective psychological interventions to deal with trauma in the acute and intermediate phases. So these are my references I used today during my presentation. I would like to thank my co-authors, especially lead author, Dr. Sheikh Shoaib from Kashmir, India, other co-authors from Iran, Afghanistan, Nigeria, and Ukraine and Sri Lanka for their valid contribution and support. I would like to thank the President of IACAPAP and the Vice President, Dr. Kim, as well as Sue for their immense support. And I would also like to thank Dr. Udain, our President of the Sri Lanka College of Child Psychiatrists and the Council. To end my talk, I would like to say, imagine that we would have to go to an intergalactical or interplanetary conference of mental health professionals. And we have to talk about our experiences from our planets. Let's say you as a child psychiatrist or a psychologist or a social worker having to meet a similar professional from an alien planet. And he or she would ask you, how are the things in your country? And you would say, my planet is full of conflicts. And obviously, this alien would ask you, are these conflicts between your species and a different species? And we would have to say, no, it is between among us in the same species. And that would be a very sad, unfortunate, and obviously embarrassing moment. Even though we have not yet contacted the aliens, this gives a perspective of what we are going through as a community in different parts of the world. So thank you, IACAPAP, for this opportunity on behalf of the Sri Lanka College of Child and Adolescent Psychiatry. Thank you.
Thank you very much, Miyuru, for that very informative talk. There were several questions. I'll just, because there were, a few inquiries into whether the booklet, which was in Sinhala that you showed that you had used in helping children with trauma. There were some queries whether that is available in English and whether that could be made available.
Thank you for that question. The booklet is only available in Sinhalese at the moment, but we are in the process of translating it to Tamil first, maybe then later English. The booklet in Sinhalese, if you are familiar with the language Sinhalese, it is available on ResearchGate. And if you just go to the account of our university, you can find it there on ResearchGate.
And there was another question from a Hungarian colleague. He had asked that his question was, how would he be able to help a child affected by war if he were to meet them only once or twice? And this colleague is anticipating the possibility of children from Ukraine having to help children from Ukraine.
So very interesting question. What I would like to say is that from what I've learned from after the Easter Sunday attack, there was one 18-year-old girl who was at the site of the blast and obtained some head injury. A particle from the bomb had gone through her scalp and there was some significant injuries and disfigurement on the upper part of the face. So what the parents were saying that they were not able to get her out of the house because she was so distressed and she was refusing to come to the hospital, which was just 25 kilometers from their home. So how we manage her was completely over the phone. And because of sometimes we use video calls, sometimes we use only audio calls. And even though it didn't help her 100%, with simple advices on relaxation, what to do, helping parents to understand her anger and irritability made a huge difference. And after a few months, actually she came to the clinic and met us physically, and now she's back in school and doing her work as normal. So what I have to say to that Hungarian colleague is that maybe you can initiate a toll-free hotline so the children can speak from Ukraine to you. Maybe a few hours today, you can get together with your colleagues so you can support the children across the border and support them. And also, maybe if you are aware of languages used in Ukraine, maybe you can develop some psychoeducation material that can be shared over social platforms so the parents know what to do when a child is in distress. So those are my suggestions.
Thank you, Miyuru. There was another question again related to Ukraine. The question was, what can we do at this time for the children in Ukraine? I think it was related to seeing videos on social media of the kind of trauma and tragedies going on in Ukraine. So, I think it's probably really, asking questions on a more broader basis. If we were not to really meet these children, what kind of things can we actually do? What kind of advice or what would be helpful? I know that parents being able to identify features of trauma is one that you had already mentioned that, but what else can you say?
Right. Thank you for that very important question. What I have to say is that first of all, I don't know the exact answer for that question, but I would like to say is that when children are affected by this trauma, the biggest barrier of helping them is parents not recognizing them, either because parents themselves are traumatized, are in an agitated, distressful state. Second, parents may not be aware of psychological disturbances after such trauma. And thirdly, sometimes in some cultures, physical symptoms are given more priority than psychological disturbances like nightmares and poor sleep. So in this context, if you can prepare maybe short videos that do not consume lot of data, that can be maybe seen within 3 minutes on a social media platform, giving maybe that video can contain a psychologist talking to a young child and trying to calm that child, maybe a demonstration. So that can be seen by the parents while they are escaping the war in a bus, train, truck. Still they can watch that video and use those simple techniques, mainly behavioral techniques, to support this child. Also, as a principle, I think the psychiatric fraternity of the world and IACAPAP have to make a statement that the significance of dealing with this trauma, otherwise what would happen is there will be significant unhealed trauma which will be transmitted to the next generation, and the hatred will never end, leading to more and more conflicts. So we need to emphasize as an international organization the importance of helping children with psychological trauma. And there are many ongoing conflicts. So this is not an easy task, but sometimes some psychoeducation material may not need the actual language to be understood. For example, sitting down, drawing a picture, telling a story, playing with the child, these can be even understood even when the viewer does not understand what the video contains. So I think these are the strategies we can use to support kids.
And also kind of related to that, colleague in occupational therapy has raised the question of the importance of preserving some kind of routine even during periods of trauma. Would you like to comment on that as well?
Thank you. I think you are absolutely correct. Routine and structure to life is very important. So after the Easter Sunday attack in Sri Lanka, all the families were glued in front of the television sets watching media because there were so many rumors about further aggravated attacks. So everyone was watching news, and some people didn't go to shops, some people didn't attend public places. So this kind of sometimes fake information can trigger community distress and even can lead to further violence. So without children having to sit in front of a TV or looking at the phone about information about this trauma, it is very important that they have some daily structure with aesthetic activities, maybe playtime, maybe educational activities. But sometimes, like in the situation in Afghanistan, Mali, West Africa, maybe in Ukraine right now, families are fleeing and they may not have the capacity to do these things. But sometimes what the parents and the grandparents can do is maybe share some of their experiences of similar things they have experienced. So children can feel this is an universal experience like fear, anger, and distress felt by all humans in certain aspects or situations in their lives. So this is not something only unique to me, but a universal experience of fear, distress, and most importantly, the uncertainty. So I think maybe if the parents and grandparents can share their experiences, that may be very supportive for children.
Another colleague from Australia has kind of pointed out the importance of cross-national psychological support for trauma. And I think even in this forum, sharing information on how to deal with situations is very important for all of us, I think. I mean, because each conflict is different and has its unique aspects. So thank you for raising that point as well. Because we are running out of time, maybe you could answer one last question, Dr. Miyuru. There was a question, I'll try and combine these two questions. There was a question on probably the social consequences of trauma later in life as related to childhood trauma in conflict areas. And also a query about what were the positives and the negatives of working with a broad group of people, of health workers and other agencies as well. I mean, I'm aware that adults who are trying to help children who may be affected by trauma and also have their own traumatic experiences that they are trying to deal with. For your ideas, Miyuru.
So when we watch international news right now, we can see Ukrainian people very unified, fighting together. So sometimes during a complex situation, because of the human nature of solidarity, something unifies us in this kind of complex situations. So after the Easter Sunday attack, the teachers, nurses, counselors, and other lay people who were involved in supporting children were very unified in the essence of, in the focus of helping children. So because of their primary goal is to help the children, it was very easy to work with them because the group was very motivated. I'm sure if we work with this kind of a diverse heterogeneous group in a different time, it would have been difficult and may have not worked very well. But because of themselves as parents, of their obviously their counter-transference of their children suffering after this Easter Sunday attack made them heavily involved and motivated and energetic to get involved in this project. So I think that was a positive point, and I can understand that sometimes it may be very difficult when you have to work in a different kind of healthcare work.
So I think we are running out of time. And so we will kind of end the question and answer session here. So thank you very much to Dr. Miyuru Chandradasa. Over to you, Dr. K.
Okay. Thank you very much. I'd like to express my deepest gratitude to Dr. Udena about the you have had a very wonderful chair. And also, I would like to thank to Dr. Miyuru for the giving very meaningful lectures nowadays and today, and with the heartbreaking case studies. And I learned a lot about the traumatized children management and our possible action to right now to help them in Ukraine also. Thank you very much for the wonderful lectures and wonderful chair. Thank you. As a host and also as a vice president of IACAPAP, I want to give a few publicity words. I will show you the okay. I want to tell you about the next IACAPAP Lunch and Learn webinar will be held in May 24th in this year. The topic of the next webinar will be the mental health intervention for the children and young people in Africa, importance of psychosocial treatments. It will be spoken by Dr. Cornelius Annie, who is now honorary senior lecturer in Imperial College in London. So I think you can, as attendees, you can learn much more things about the effective treatment for children and adolescents with mental health difficulties, especially psychosocial interventions. And next publicity words is that if you have interest in the becoming IACAPAP member, you can connect our IACAPAP homepage membership site. You can contact the Secretary General to get an application form. So if you have any interest in IACAPAP members, please connect the IACAPAP homepage website. And final one is the IACAPAP International Conference, which will be held in Dubai in around December 5th this year. We look forward to the attendance. I think this is very interesting, very exciting the event in the very nice area like Dubai. Now call for submission is now open, and you can register with a super early bird rate. I think you can connect the IACAPAP 2022 Dubai conference website. Thank you for your the very goodwill to attend our webinar today. Thank you, and also we look forward to see you in the next webinar again. Thank you very much. Bye-bye.